Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow. Thank you for joining us here on the NPTE Final Frontier podcast. My name is David.
And my name is Emily. Today, we will be discussing the common special tests for diagnosing an anterior cruciate ligament, or ACL, and a posterior cruciate ligament, or PCL tear. So on our last episode, we dove into the common mechanisms of injury for an ACL and a PCL tear. So make sure you go head over to that episode to listen if you haven't done so already. So first, I will be diving into the common special tests for an ACL tear. The Lachman's test is one of the most common tests in diagnosing an ACL tear. The patient is in the supine position. The physical therapist will hold the patient's involved knee between full extension and 30 degrees of flexion. They will then stabilize the femur with one hand and with the other hand, move the tibia forward. It has been reported that the best results during a Lachman's test is achieved with the tibia slightly externally or laterally rotated and the anterior tibial translation force applied from the posteromedial aspect. The test is considered positive by a mushy or soft end feel with forward movement or translation of the tibia. This would be increased anterior translation with the medial rotation of the tibia and disappearance of the infrapatellar tendon slope. Further, there are other modifications to this test, but we will not be discussing those right now. And secondly, we will discuss the anterior drawer test. Again, the patient is in the supine lying position. The physical therapist will grasp the patient's lower leg just distal to the knee joint space, and the knee will be flexed to 90 degrees of flexion so that the foot is flat on the examining table. The therapist will sit on the patient's foot to be able to stabilize the leg. They will then place both of their hands either on the knee joint space or just distal to it to be able to assess the knee joint mobility and pull the lower leg forward. The test is considered positive when there is abnormal anterior movement or translation of the tibia on the femur compared to the other extremity. Again, there are other variations to this test, but we will not be discussing those right now.
Now I will be reviewing the common special test for a PCL tear. Let's start with the posterior sag test. To perform this, the patient starts by lying in supine with the hip flexed to 45 degrees and the knee is flexed to 90 degrees. The test is considered positive if the tibia sags or drops back on the femur due to that torn PCL. Posterior tibial displacement is more evident when the knee is flexed between 90 degrees to 110 degrees. There's also visible sulcus and a loss of step. Now let's talk about the reverse Lachman test. To perform this, the patient is lying prone with the knee flexed to 30 degrees. The physical therapist grasps the tibia with one hand while fixing the femur with the other hand, and then pulls the tibia posteriorly while noting for any excessive posterior movement, the tibia, and for the quality of the end feel. The test is considered positive if there is excessive posterior translation of the tibia. Now let's talk about the posterior draw test. To perform this, the patient is lying in supine with the knee flexed to 90 degrees of flexion. The physical therapist then posteriorly displaces the tibia on the femur. The test is considered positive if there is excessive posterior translation of the tibia.
So just remember, warriors, these are only a few of the main special tests used to diagnose an ACL or a PCL tear. There are other tests out there, so you can go review those further if needed. Now, whenever you are reviewing special tests, it is important to learn the name of the test, understand how to perform the test, be able to identify what ligament is being evaluated, and be able to interpret a positive finding.
Now that you understand the common special tests for an ACL tear and a PCL tear, here's a quote from the Dalai Lama. Happiness is not something ready-made. It comes from your own actions. So do whatever it is that makes you happy. Take action. You want this dream. You want that license. So take action. Go create your happiness today. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Till next time, have a great day and a powerful tomorrow.